Hi all, in this class we are going to see the next interesting topic in unit 3, that is the epilepsy. For epilepsy there are different alternative names, that is one is seizure, another one is fits. So in this class we are going to see the basic information about epilepsy, that is the definition of epilepsy, and followed by we will see what are the root cause of epilepsy, so that the people is being get affected. Next one is we will be discussing what is the different classification of epilepsy. So the epilepsy, if you see the definition, the epilepsy is the recurrent seizure disorder that is because of abnormal electrical discharge or electrical activity from the brain, especially in the area of cerebral cortex. So the cerebral cortex is an area. If you see the abnormal electrical discharge from that area, it will lead to the disorder is nothing but epilepsy. Okay. So the other definition is that epilepsy is a chronic seizure disorder with the recurrent and unprovoked seizures. So these are two definition. You can use any definition for your better understanding. So on the whole, the epilepsy is nothing but is a one kind of brain disorder because of abnormal electrical discharge from the brain. Okay, so let's see what is the epidemiology. That is nothing but root cause of epilepsy. So that is actually the three factors which is being involved for a person to get epilepsy. One is agent factor, second one is host factor, and third one is the environmental factors. The agent factor is nothing but if you have exposure to the toxin kind of things like lead or infection, at one point of time, these toxins will destroy the brain cells or will disturb the brain cell, so that the epilepsy will end up with epilepsy. The patient will have a seizure disorder. That is one of the reason, because of this agent factor. The second one is what is host factor. That is their own body itself one of the reason to get this epilepsy. One is like a genetic factor, or another one is at birth, from their birth, they have some brain injury or they have some problem with the brain. So that may also reason to for the people to have epilepsy. So in this case, these people will have experience of epilepsy at the different stage at their age. One is like they will feel epilepsy at the age of 20 years, or they may have first year of their life. If it is girl, they can have feel of epilepsy at the onset of puberty. So these are the different stage. If the epilepsy is because of the host factor, they can have experience of these epilepsy at, as I said before, they are like at the age of 20 years or the first year of their life or at the onset of puberty. Okay, so next one is the environmental factors. So because out of these three, the environmental factors is the very important crucial thing for the people to get epilepsy. The reason is that environmental factors is like highly involved in people involved in people activity, disturb the overall system of the body. Okay, if being exposed to any toxic gas or environmental factors and so on. So one thing is like air pollution. So air pollution, there are so many toxic gas, it's mixed out in these air. So when people start to inhale this type of toxic gas like carbon monoxide and lead poisoning, at one point of time again these gases will disturb affect the brain cells. So our brain cell will start to produce abnormal electrical activity. So the point is called the people will get epilepsy. Okay, so not only this, you have even the people, the babies. Okay, the unskilled handling at the time of birth of that particular babies will also cause brain injury. That brain injury will end up with epilepsy. Okay, so if you see the infant at the month of 2 or 3, okay, at the time of birth, especially if you see that at the time of the birth, the bones of the babies, the infants are not properly developed. It is not good enough to withstand or handle the very high pressure. So in that case, if the people or someone is handling the baby without proper way, or without any carefulness, means there are high chance for the that babies for getting injured. Okay, so that also one of the reason for the babies to get epilepsy in later stage, that is in adult stage or something. So that is one of the reason. And second one reason is like intrauterine infection, and emotional disturbance, or if the people who are mentally disturbed for continuously for prolonged time, that type of people also, where they may have some disorder, seizure disorder later at later stage. Okay, and too much consumption of drug and alcohol also end up with a seizure disorder. While taking alcohol and drugs, it's very important to see the level. Okay, how much we are consuming. So because the too much of taking these two also will lead to epilepsy. So these are the different factors, these are the different root cause for one people, for some people to get epilepsy. Okay, so there are some cases we can rectify this problem at the earlier stage, or if it is gone one stage above, in the sense based on the different kind of treatment, we can rectify this problem. Yes, in next class we will see what are the different types of epilepsy in detail. Okay, thank you.